The highly contagious Delta variant is fueling spikes of coronavirus cases across the U.S. Infections are up in almost all 50 states, and experts warn most new cases and deaths are occurring in people who have not been vaccinated. Meanwhile, there are new concerns about the Johnson & Johnson vaccine. The FDA has issued a warning about the shot after dozens of recipients developed a rare autoimmune disorder. Nikki Battiste has the details.
The FDA tonight is adding a new warning to Johnson & Johnson's one-dose COVID vaccine after about 100 people who got the shot developed a rare but serious autoimmune disorder that attacks the nerves called Guillain-Barré. The CDC says the cases have mostly been seen in men 50 and over, about 2 weeks after receiving the shot. So far, there have been nearly 13 million J&J doses administered nationwide. Given that, health officials say the benefits of the vaccine far outweigh the small risk.
We've seen this with one of the influenza vaccines a couple of decades ago. The good news is it looks like it's extremely rare.
This comes as Pfizer met this afternoon with top White House officials to discuss possibly offering a third shot of its vaccine to some high-risk Americans who have already been immunized. The company says its internal data shows antibody levels jump 5 to 10-fold after that booster. For now, the government says booster shots are not necessary.
There is a recommendation on providing boosters. It's going to be for a select portion of the population, perhaps people who are older, who are more than 7 or 8 months from completing their original vaccination. It's not going to be a general recommendation for the entire public.
Meanwhile, the highly contagious Delta variant continues to spread amid warnings that parts of the U.S. could soon become breeding grounds for other new and more dangerous variants that could evade vaccines.
If the Delta variant is allowed to accelerate, sure, I think we could see additional variants emerge.
Since just last week, average daily cases in the U.S. are up 30%, more than a third of them in 5 hotspots. And health experts are blaming the unvaccinated for the spike.
It sounds like essentially we're going backwards. Is that the case?
We are. We had this beat. And I said, if we can fully vaccinate the American people, we can resume pre-pandemic life. And now we've squandered that opportunity partially, at least in parts of the countries.
In a statement, Johnson & Johnson says it's in discussions with the FDA and other regulators. The company adds that cases of Guillain-Barré syndrome are rare, but the J&J supports raising awareness about all possible side effects. Elaine?
Nikki Battiste, thank you. For more, let's bring in Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, welcome. As we heard, new cases in the U.S. have spiked over the last week, mostly due to the Delta variant. Could this indicate a summer surge, and how much worse could it get?
It definitely is going to be a surge of Delta cases, and it's really going to be something that's been different than prior surges because not the entire country is at risk. There are certain parts of the country, Arkansas, Missouri, Nevada, where you're going to start to see more and more cases of Delta variant because there's not enough people that are vaccinated, so the virus is having an easy time infecting those. What you might see also is an uptick in hospitalizations. It's going to be a little bit of a question whether hospitals get into that same level of crisis that they saw, for example, in the spring of 2020 or the winter of 2020, because so many high-risk people have been vaccinated. But it's not going to be comfortable. And the thing about this is it's completely preventable if we get more doses into people's arms.
Well, Dr. Anthony Fauci says it's, quote, almost inexplicable that some people are not getting vaccinated against the coronavirus, even after seeing the data. Why do you believe people are still resisting vaccines, and how dangerous is that?
It's multifactorial. It's not just some monolithic vaccine hesitancy movement. Each person kind of has a little bit of a different reason why they might be hesitant to get a vaccine. Some people might be waiting for full FDA approval of these vaccines, and hopefully that's coming imminently. Other people may have inadvertently swallowed some information that's not true, that's on social media, and they're just not going to budge off of that. And then there's a group of people who will just not be vaccinated for whatever reason. To me, it is something that is baffling because we've seen real-world evidence evidence of what these vaccines can do, how much they change your life, how much they remove the risk from COVID-19. And I think that the vaccines speak for themselves. The reason why it's so different in a hospital in July of 2021 than it was in January of 2021 is for one reason, that so many high-risk people have been vaccinated. So I do think this is something that people should see as an individual value to their lives.
Well, let's talk about kids. About a third of adolescents ages 12 to 15 have received at least one dose of a coronavirus vaccine. Nearly a quarter are fully vaccinated. What are the biggest obstacles in getting younger Americans vaccinated?
I think the biggest obstacle is the fact that children tend to be spared from the severe consequences of disease. They tend not to be major spreaders. So there's a different risk-benefit calculation that people go through, including the parents of these children. And what you have to remember is that it's difficult when you're trying to put a new vaccine into children because people have legitimate questions about this, whether it's necessary. And that's something that we have to overcome by really showing people the benefit, even to that age group, of children being vaccinated, about how it gets those children back into their activities, and how even though COVID-19 might not be a severe disease for a child, it's something that can be completely preventable through a vaccine. And I think that schools are going to go a long way towards giving more privileges to students who are fully vaccinated, and that may also nudge more people to get vaccinated in that age group.
Well, the former head of the FDA says it would be, quote, prudent to begin the process of authorizing Pfizer's booster shot. Now, Pfizer was expected to meet with U.S. health officials to discuss its shot Monday. What's your take on this, doctor? Is it too early to plan for a third shot?
I don't think it's too early to plan for a third shot, but I think it is definitely premature to say that we will definitely need a third dose of these vaccines in the short term if you're a healthy individual. There may be a different conversation that we have about immunosuppressed populations that had, for example, an organ transplant. But for the general public, I would like to see high levels of breakthrough infections landing people in the hospital to say that we definitely need a booster. And we're not seeing that. What we're seeing is that when it comes to serious disease, hospitalization, and death, vaccines that are out are still doing really, really well. So I don't think this is something that we can say is definitely going to be needed in the short term. I think it's important to plan. It's important to have a booster ready to go in an approval pathway at the FDA, but I don't think it's time to pull the trigger now.
Meantime, the FDA has issued a new warning about the Johnson & Johnson vaccine. As I understand it, Dr. Officials say there is a possible link to a rare autoimmune disorder. What more can you tell us about this, and is it cause for concern?
What the regulators are talking about is a small risk for Guillain-Barré syndrome. So this is an autoimmune neurologic disorder that happens after several types of infections and can also happen after vaccines. And what they've seen is about 100 reports of Guillain-Barré syndrome following the J&J vaccine, primarily in older men. It's important to remember that this is a disease that starts with weakness and it kind of ascends from your lower extremities up your body. There are some people that it can infect their muscles of respiration, of breathing, and they may run into some trouble and may need to be put on a ventilator, but it's not very common that happens. What we're seeing are mild cases, and you're talking about 100 cases out of over 21 million doses given. So it is fairly rare. And when you do that risk-benefit calculation, the J&J vaccine comes out on top. That this is something that still is not outweighed by the great benefit the J&J vaccine offers. But it's something to be aware of. It's something for clinicians to note in case they have a patient that this might happen to. But it's something fairly rare and it's manageable.
Really important context, Dr. Amesh Adalja. Doctor, thank you very much.
Thank you.